Hello and welcome to the Ivan Show. On this episode, I host a senior doctor who's going to talk about nose picking. He's Dr. Mkwanga Hakim. He's a medical laboratory technologist and is well informed with scientific knowledge of nose picking. Doctor, welcome to the show and thanks for allowing to speak to us.
Thank you so much.
We want to straight away go to the first question. Help us give us the background and the broad view of nose picking and the roles of the nose.
Thank you so much, Mr. Ivan, and thank you so much, our dear viewers. And I'm so happy to be here at this show. So, the nose is basically one of the parts of the body, and it has quite a number of functions. And one of those functions actually goes into helping us in the sense of smell. So basically, we have a nasal cavity that is comprising of quite a lot of organs or a lot of tissues, and in those we have the sinuses, we have the mucosal linings, we have the cilia that line the nose, and all these are basically functioning to, number one, see that they act as a first line for trapping any dust, any pollen, any pollutants that may be entering throughout the nose, preventing them from reaching the lungs. That is number one. Number two, we have what we call mucus in the nose, and this is secreted by the goblet cells in the mucosal linings. And basically, the use of the mucus is to, number one, to trap the bacteria, and then number two, it contains antibodies that are going to kill that bacteria, so that the bacteria doesn't go ahead to come into our lungs to cause further infections. So this is the brief aspect of the importance of the nose and the nasal cavity. So with the issue of nose picking, nose picking is a behavioral aspect. It is more of psychological aspect, whereby someone uses their hand or whatever object they can have on their disposal to squeeze out the content of the nose, because sometimes it can be itching, and itching can cause this irritation. So someone, to relieve that irritation, they prefer to use their hand, any hand, whether the index or the small hand, to pick their nose to remove that itching or irritation. So this nose picking, as I've told you, it is a behavior that is very widely spread. It is not only in Uganda, it is not only in Africa, it is widespread behavior that some people, sometimes they find it as a stress reliever. If someone feels anxious, they prefer to pick their nose, and they feel relieved when they pick their nose sometimes. But it's not a health behavior, and actually in most societies, it is considered as a deviant behavior, and we try as much as possible to prevent people from doing it, because sometimes it causes adverse reactions and also health issues that can bring about, lowering of the immune system. So basically, this is nose picking in a layman's
Why do people develop this behavior?
As I've just told you, sometimes it is due to the irritation that comes with whichever content is in the nose. We have what we call cilia in the nose. Cilia, these are projections of the mucous membrane, and they help to move the mucus away from the nose back into the throat, because this mucus, when it moves back to the throat, it normally goes into the throat and joins the respiratory tract, joins the digestive system. But sometimes this mucus, the mucus that is closer to the opening of the nose, gets dry due to loss of moisture, and when it's dry, it cannot be moved by the cilia back into the throat. So what happens is, it causes an irritation when it is dry, and some people prefer to pick out that irritation by hand or whichever object they find close to them to pick it out. So sometimes this causes the nose picking. Then number two, socially, some people find it embarrassing to have, that dry mucus in the nose to be seen by other people. So they prefer to pick it out before they can be seen by other people that they have, some congestions in the nose.
Doctor, if I can come in, what are medical risks associated with nose picking?
There are quite a number of them because as a medical laboratory technologist, we explore more in the microbiota of the nose. And the nose is having quite a lot of bacteria that are housing the nose. Some of them are normoflora. Normoflora, these are bacteria that are normally present in different parts of the body. So the nose also is not different from other parts of the body. It houses a number of normoflora, normal bacteria that are normally there. So whenever you do nose picking, you're disrupting sometimes the normal microbiota of the nose. And when you do this, you give rise or you give chance to new bacteria colonizing the nasal area. For example, our hands are dirty most times and they house a number of bacteria. And most so if you have long fingernails, you house quite a lot of bacteria in those fingernails. So whenever you use that dirty finger and you introduce it in the nose, you're introducing new bacteria that wasn't present in the nose at the first time. So when you introduce that bacteria, we don't know which bacteria you're introducing. It might be Staphylococcus aureus, it might be strep, it might be any other bacteria that could cause disease. So when you introduce that bacteria, it is disrupting the normal bacteria that was there and thereby causing what we call inflammation of the nasal cavity. We call it rhinitis. And when you do this, it increases sometimes even the secretion of the nose. And to a larger extent, it can damage the septum, that part that divides this nostril from this nostril. Sometimes it causes infections in that septum, and it causes damage to the septum. To a greater extent, if at all you're unlucky, you can cause further infection to the sinuses, and also further infections to your inner respiratory tract. As I told you in the introduction, the nose serves as a first line barrier to prevent infections from going into the respiratory system. That is the lungs and the alveoli. So anything that disrupts its microbiota is also disrupting the lungs and the bronchi and everything. So quite a lot can be associated with nose picking, and a lot of health risks can come with nose picking.
Doctor, do we have any benefits associated with nose picking?
Maybe something that I might have forgotten on the health issues with nose picking.
Yes.
Just before I go to the benefits.
Yes.
If at all they are there, I know.
Yes.
There's a disease that we call Alzheimer's disease. It's a disease of the brain.
Yes.
And a recent research from the University of just a minute. Just a recent research has shown that from the Griffith University has shown that there is a specific bacteria. This is called Chlamydia pneumoniae. What happens is that Chlamydia pneumoniae is associated with Alzheimer's disease, and it is exacerbated with the act of nose picking. So whenever you pick your nose,
there is a relationship between Alzheimer's and nose picking.
Exactly. How is it associated? That when you do nose picking, you can introduce this bacteria called Chlamydia pneumoniae into your nose, and what it does is it has an affiliation to travel through what we call the olfactory nerves. Olfactory nerves are nerves responsible for the sense of smell. So these bacteria normally move through the olfactory nerves and they join the brain. And what is scary is that the olfactory nerves are not associated with or they are not prevented with the brain, with the blood-brain barrier. So they pass through easily and connect to the brain. So what happens is this increases the chances of someone getting Alzheimer's disease. So nose picking is also associated with the Alzheimer's disease through this bacteria. So it is advisable that before you pick your nose, most especially, you have to clean your whichever object that you're going to pick your nose. We shall see that in the benefits of not in the benefits, but in the better ways of nose hygiene or picking your nose. Yes. So coming to your question, is there any benefit in nose picking? What I can tell you is, apart from relieving the itching, probably there is no benefit to nose picking, unless if you do it the right way. Because apart from maybe removing the stuck items in the nose and maybe relieving your itching, there's not much benefit in nose picking.
How can we stop nose picking?
Now, stopping nose picking, it depends on the underlying condition. Why are you doing the nose picking in the first place?
Yes.
If you're doing it because you want to relieve the itch that you're having, then to relieve that itching, number one, you can use what we call a saline spray. Saline is normal water. It is not antibacterial. It is not having any chemicals. It is just a concentration of salt that we normally use also. It's normally the content that they use in the drip, the drip water that they use, that is normal saline. So if you use normal saline spray, it's a small spray that we use to moisten our noses, and it will soften the mucus particles that have dried up in the nose, so that you can easily pick them with what we call, you call them wipes. You can use a wipe to just pick that. And even when you're doing it, as I told you, it's not a social behavior. So it's better you do it in a private way, whereby you maybe move around the corner and spray your nose with normal saline and then pick the nose. Then if at all it is a habit, and if it becomes a habit, we normally give it a name known as rhinotilexomania. And this is when a social habit for you to pick the nose. Some people do it even for almost an hour in a day. So,
no, doctor, is it addictive?
To these people it becomes addictive because, anxiety.
Yes.
Let's say if someone is not used to being on a TV show like this one,
Yes.
they become anxious. And when they become anxious, they normally find a solution to that anxiety. Either they pick their nose, or they scratch themselves, or they bite their tongues, or they bite their lips. So all that is an effect of anxiety. So if you feel like it is because of anxiety, we have quite a number of ways to deal with anxiety. Number one, you can use a stress ball. There are those balls that are made in a way that when you're feeling anxious, you squeeze them a little bit so that you can relieve that anxiety. Instead of picking your nose, you just do that squeezing. Then number two, you can listen to some soothing music, like classical music, the kind of music that can relieve you from that kind of stress that you're having. And then some other ways of getting rid of nose picking, if at all it becomes a behavior or an addictive behavior, we call it. You can set a reminder, and that reminder, a simple way is, bandages.
Yes.
You can use a bandage, a sticker bandage. If I'm using, let's say I'm someone who is addicted to nose picking. If I'm using this finger, I can put a sticker bandage on the finger, so that anytime that I want to do nose picking, whenever I raise my finger, I see that sticker bandage.
Just reminds you.
Yeah, so it just reminds you that you're not supposed to do nose picking. So that's another very effective way of dealing away with nose picking. Then if at all you feel like it is something that you can't deal away with all these other ways that I've given you, you can seek guidance from either
Medical technician.
a medical person, a medical personnel, or a psychologist. They can give you more ways, or a counselor to give you more ways of how to deal with nose picking.
Dr. Hakim, how can we help young ones or young children stop nose picking?
Yes, for the young ones, they normally do it as also a behavior or a way of relieving the itching that they might be having. You know, young ones do things by instinct. They don't think when they are doing things. So what we can do, what parents can do for the young ones is, number one, you stress the point that no speaking is a bad behavior.
Yes.
And you try as much as possible to stick it in the heads of these young ones. How? You don't do it in a rush way, or you don't do it in a provocative way. For example, you can find a kid picking their nose. You don't shout at them, because when you shout at them, they will probably damage their nose, their nasal cavity, or their septum. So after they do their nose picking, you can pick them up, take them to the wash area, wash their hands, and as you're washing their hands, you stress the point that hands are not meant for the nose, and this is a bad habit that you're not supposed to do. And sometimes kids don't lie. They'll tell you that probably I'm doing it. Sometimes you can ask, why are you putting your hands in your nose? So they'll tell you probably that maybe my nose is itching or my nose is irritating. So as a good parent, you can find out if they are doing it in a constant manner. Sometimes maybe they are having an infection in their nose. So you seek medical attention so that you can treat the itching of the nose. And some other times, if they're just doing it as a habit, you stress out the point. What I want to tell the parents is that don't say it once or just twice, because kids take long sometimes to learn something, to learn a behavior. Do it repeatedly and don't get tired to do it. And as you do it, kids also learn from examples. If they see you picking your nose, however much you tell them not to pick their nose, they will continue picking their nose because they are learning from the superior person, yourself. So you shouldn't do the same behavior that you're preventing them from doing. Yeah, you should not pick your nose in the first place, so that you can tell them not to pick their nose.
What is the proper way of picking our nose?
Exactly. So the proper way of nasal hygiene is what I've just told you in the past. Use saline sprays to moisten the nose. Number two, you can use what we call wipes. You know wipes? Yeah, wipes are moist, and the moisture is not. You shouldn't use antibacterial solutions. Some people use sprays that are antibacterial. Now, when you use an antibacterial spray, it is going to kill the bacteria that are in the nose, and some of those bacteria are good because they prevent other harmful bacteria from colonizing the nose. So if you use antibacterial sprays, you're actually killing those bacteria, and therefore when you introduce any bacteria in the nose, they are going to cause infections. So use any spray that is non-antibacterial to just wipe your nose. And I told you should do it privately without other people seeing it because it's a private issue. And then number two, if you're well off, whenever you're in a room, you can use what we call humidifiers. These increase on the moisture of the room so that you prevent, what brings about the itching is the dryness of the mucus that comes in the nose. So it prevents, the humidifiers increase on the moisture in the room and they prevent that you having dry mucus in your nose. Then other ways, if you find it addictive, you talk to a medical personnel so that you can seek guidance on how to get rid of it. Yes. And you'll find that some people, they do the picking, but it doesn't cause any problems. Yes, that is for some people, but just in case it causes any issue, it can be a serious issue. Like I've just told you, it has a connotation with Alzheimer's disease. And this disease is a serious disease that affects the brain. So you don't want to have all these issues. And also, I can just give you a small research that was done. In COVID-19 pandemic, it was found that for the medical workers who were doing nose picking, they had a 75% chance of developing COVID-19 than medical workers who are not doing the nose picking. So nose picking increases the risk of respiratory disorders, and therefore we should deal with it. So scientifically, picking your nose is unhealthy, but if you're to pick it, to pick your nose, do it in a safe way. Yes, because sometimes it's inevitable. You find the nose irritating so much, and you feel like that irritation has to be removed by picking your nose. If you're to do that, and you're a perpetual nose picker, I've told you, tie a bandage, a sticker bandage, around the normal finger that you use to pick your nose. It will prevent you from picking your nose using your finger. Number 2, use a wipe when you're to pick your nose. Yeah, it's the same thing. You know, I don't know if you know that picking wax from our ears using a cotton wax, a cotton wax picker, is not healthy. But people do it.
Majority do.
Exactly, majority do it, but it's not healthy.
What is healthy?
So what is healthy is you're supposed to use something that is not going to leave any remnants in the ear, because you know cotton can be left in the ear, and when it's left in the ear, it's going to cause infections. You know that cotton pad can be, for some reason, it can log in the ear, and it causes otitis media. This is inflammation of the middle ear. So it is not advisable for you to use to remove your wax using that. What is advisable is you can use sprays or drops, ear drops, that are going to soften that wax, and it will come out by itself. When you go maybe in the shower, and when it comes out by itself, you use you know some wipes to just remove from the outer ear, so that you can just throw it away.
Doctor, give your scientific parting shots to our dear viewers who are extravagant or who are not deliberately doing nose picking. They are ignorant. They are doing it, but they are ignorant. Give them the scientific parting shots as we wind up our discussion.
Thank you so much. My last remarks to our dear viewers is that nose picking is a behavioral characteristic to some people, and sometimes it's inevitable for you to do nose picking. But my advice is, as we've just talked about in our whole show, try to emulate those simple ways of how to prevent nose picking. And if I told you to do nose picking, do it in a safe way, using those different methods that we've given you. If you find it as an addictive behavior, try to seek medical attention. There are quite a number of medical professionals that can help you out. If you have your doctor, visit them regularly so that you can find better ways of preventing this social norm or social behavior that is taking up most of the people. As I've just told you, most people do it in a fun way or in a normal way, but this is not a normal thing. And it is not something that is going to cause a lot of infections, just in case you do it. But just in case it does, it is a severe infection that you can get. So our dear viewers, try as much as possible to prevent nose picking and try to emulate the better ways of nasal hygiene. Thank you so much.
Thank you so much, Doctor, for allowing me to speak to us.
Thank you so much.
I implore you, viewers, once you are going to watch this show, I implore you to look for a scientific dictionary. Otherwise, the scientific language used on this show this time round is not an easy one. I am Ivan Skundari, and this is The Ivan Show.
IT Media.
Empowering truth, inspiring change.